Hello and welcome. Today we are going to discuss about chickenpox. Varicella zoster virus is a human herpes virus 3 which produces two distinct diseases by causing primary infection that leads to chickenpox, which is also called varicella, and causes reactivation infection which leads to shingles, which is also called herpes zoster. Chickenpox usually occurs in children and young adults, while the shingles commonly occurs in adults. Now let's talk about chickenpox in detail. It is caused by the varicella zoster virus, as I mentioned before. The chickenpox predominantly affects children. It is transmitted via respiratory secretions such as sneezing and cough. However, it can also spread through direct contact with varicella zoster virus infected vesicle fluid. Now the clinical features of chickenpox. The clinical features after about 2 weeks starts to show up, and they are divided into 3 phases. Number 1, prodrome phase. Number 2, exanthum phase. And number 3, latent phase. We'll discuss these phases one by one. First one is prodrome phase. This phase lasts for about 2 to 3 days and comprises of fever, malaise, and headache. This phase usually occurs in adults, not in children. Now, exanthum phase. This phase is characterized by approximately 250 to 500 severely pleuritic lesions in varying stages of development. Let's study various stages of chickenpox lesions. Number 1, papules. It is the rash that begins as multiple small red bumps that look like pimples. Number 2, vesicles. After about 12 to 24 hours, the papules become itchy and fluid-filled bumps called vesicles, which look like dewdrops on rose petal, also called teardrop vesicular rash. Number 3, pustules. These are pus-filled lesions which cover the broken vesicles. Now the last one, latent phase. After the resolution of chickenpox, the virus remains latent or dormant, either in sensory nerve root ganglia of the spinal cord, also called dorsal root ganglia, or in trigeminal ganglia, where the virus can reactivate during episodes of stress or immunosuppression, and that leads to shingles, which is also called herpes zoster. Now the complications of chickenpox. Severe chickenpox infection leads to spread of varicella zoster virus. If the virus reaches brain, it can lead to encephalitis. In liver, it can cause hepatitis. In lungs, it can lead to pneumonia. It can also cause scratching from itching, which leads to secondary bacterial infection, and this is the most common complication of chickenpox. Now, how to diagnose chickenpox? It is primarily diagnosed clinically by recognizing the rash, but if necessary, chickenpox can be confirmed by detection of antigen through direct immunofluorescence method, or by detection of DNA through polymerase chain reaction. Let's talk about the treatment of chickenpox. Treatment is usually supportive in stable patients, like treating fever and pain with acetaminophen and treating pruritus with calamine lotion and oral antihistamine. The antiviral therapy is given only in severe varicella zoster virus infection, and the antiviral drug usually given is acyclovir. How to prevent chickenpox? There are 2 methods. One is active immunization, second one is passive immunization. In active immunization, varicella vaccine is given, which consists of 2 doses. One is given at 12 to 15 months of age, and the second one is given at 4 to 6 years of age. In passive immunization, the varicella zoster immunoglobulin is given. passive immunization is indicated in immunocompromised patients, like in acute leukemia and HIV. Also indicated in pregnant women and in newborns if the baby is premature or the baby whose mother develops chickenpox within 5 days before delivery or 2 days after delivery.